We want to show folks what it looks like when a patient is actually speaking to somebody. So what is this we're looking at, doctor?
Well, you're seeing two views here. The view on the left is the view that you see the doctor or the nurse in our telehealth center sees. So they can see the patient, they can see the nurse at the bedside, they can see in the room. And the camera that's used on the left there is a pan-tilt zoom camera. You can zoom in very tight on that. If you zoom in, you can actually, we can't do it on this because it's just a setup, but the doctor or the nurse can zoom in and actually read the name band on the patient's wrist.
Oh, wow.
They can read all of the medications that are hanging on all the IV poles. They can read all the ventilator information.
And what's the reaction you get from the patients? Are they like, this is weird, this is freaking me out, or do they think, this is fantastic, I'm totally down with this?
Well, it's interesting. When we first started in 2006, we were worried about that kind of information. How would this be received by the patients? And in fact, it's been very well received. We have now seen probably and taken care of almost 100,000 patients using this system, I would say, since 2006. And when a patient goes into the ICU, we have a pamphlet that we give out to the patient that explains what this is, and we talk to the families. And at first they're a little bit confounded by what this is.
For sure, yeah.
But you know, the way the system works is that the camera, which is mounted on the wall, is not on all the time. In fact, it's only on probably for a minute or two every couple of hours. And when it's turned off, it's actually turned backwards.
Okay.
So that the patient is aware that it's not on. But when the camera comes on, it wheels around and faces the patient. So they quickly become aware of when the camera is on. And when the physicians or the nurses enter the room with the camera and turn it on, there's a little electronic doorbell they ring that the patient in the room can hear that doorbell so they know it's being turned on. And we thought that patients might initially not be too receptive to this, but of the 100,000 patients we've probably seen, or close to that, probably in the 12 years that we've been up, I would say that maybe a half a dozen or 10 patients have said, no, I don't like that, don't turn the camera on.
And then you don't?
We don't. Well, what we do in that case is we avoid turning the camera on as much as possible. We still continue to monitor their status through all the data we receive through the telemetry. And if there's a really significant event like a cardiac arrest, of course we turn the camera on and go in there and take care of the patients.